All right, let's dive into a really fascinating and, frankly, disturbing story. We're going to uncover how a well-intentioned AI, one designed to help the very sickest patients, ended up doing the exact opposite. This is a story about a hidden bias buried deep in the code that led to massive real-world discrimination in healthcare.
So, this is the central question, right? It's a real paradox we're going to unravel together. How can an algorithm, a piece of code, specifically designed to find and help the most vulnerable patients, end up systematically ignoring them? It just doesn't seem to make sense. How is it even possible for a tool built to help to instead cause so much harm?
Okay, so here's the core discovery from a bombshell study back in 2019. And this is where it gets wild. Research has found that when a black patient and a white patient were given the exact same risk score by this algorithm, the black patient was, on average, way sicker. Just let that sink in for a second. Same score, but a completely different health reality. It means the algorithm was just systematically underestimating the needs of black patients.
And what's so crucial here is that the intention wasn't malicious. This wasn't some evil plan. The software is from a company called Optum and was being used by hospitals caring for around 200 million people. The goal was actually simple and, pretty noble. Use an algorithm to proactively identify high-risk patients who need extra care, things like more nurse check-ins or follow-up appointments. It was supposed to make healthcare better.
So, if the goal was noble, where did it all go so wrong? To really get that, we need to pop the hood and look at the algorithm's code. We've got to find that one single critical flaw that created this massive disparity.
And the flaw? Well, it all comes down to a key concept in data science, the proxy variable. Now, what's that? Basically, when the thing you really want to measure, like how sick someone is super complex and hard to pin down, you use a stand-in, something that's easier to measure. That's your proxy. And as you're about to see, the choice of that proxy is everything.
And here it is. This is the aha moment. This was the critical mistake. The algorithm's designers needed a proxy for health needs, right? So they chose healthcare costs. Now, on the surface, that kind of makes sense. You'd think sicker people cost more, right? But the problem is, this meant the algorithm wasn't actually trained to predict illness. It was trained to predict spending.
And this is the absolute crucial point. Cost is a terrible proxy for need, especially in a system that already has deep structural inequities. Here's why. Because of systemic bias and just plain barriers to getting care, black patients in the U.S. often receive less medical treatment, and because of that, they generate lower costs than white patients who have the exact same health problems. So what did the algorithm see? It saw lower spending, and it learned lower risk. It wasn't measuring need at all. It was measuring a long history of unequal access to care.
This wasn't just some theoretical error in a spreadsheet. This flawed logic had devastating, real-world consequences for actual patients. So now let's take a look at the true human cost of getting that proxy so wrong.
Just look at this difference. It is absolutely staggering. The study estimated that because of this bias, the algorithm only flagged about 18% of black patients for these extra care programs. But if the algorithm had been corrected, if it had actually been looking at health needs, that number should have been almost 47%. The bias literally cut the number of black patients getting extra help by more than half.
The researchers even put a dollar amount on the gap that the algorithm was learning from. They found that on average, black patients racked up about $1,800 less in medical costs per year than white patients who had a similar number of chronic illnesses. And again, that gap isn't a sign of better health, it's a signal of unequal care that the algorithm just took and amplified.
And when the company itself reran the analysis on a massive national dataset, the results were just as stark. For patients with the exact same algorithm-assigned risk score, the black patients were collectively managing nearly 50,000 times more chronic illnesses than their white counterparts. That is a massive, unaddressed burden of disease all hidden from the system.
Now, it's really tempting to look at this and think of it as just a single coding bug, a simple mistake. But the failure was so much deeper than that. It was baked into the entire life cycle of the AI system, from the very first idea all the way to deployment.
This chain of failure really shows how the bias got locked in at every single step. First, the problem itself was framed wrong. They targeted cost, not need. Then, the data they collected was already biased because it reflected historical inequity. Step 3, the model was tested to see if it was accurate at predicting costs, but not for fairness. And finally, once it was out in the world, it became this gatekeeper to care, with nobody auditing its impact until it was way too late.
And we need to be clear, this isn't just a US problem. This faulty logic, using money as a stand-in for need, is a huge global risk. I mean, imagine this same kind of model being used in a place like India, where marginalized communities already face enormous barriers to care. An AI trained on insurance claims there would inevitably learn to ignore the very people who need help the most, just making existing inequities even worse.
Okay, but this story isn't just about the problem. It's also about the solution. And there are some really powerful lessons here for our increasingly automated world.
What's remarkable is that the bias was actually fixable. The researchers worked directly with Optum, and they retrained the model to focus less on cost and more on actual health outcomes. And the result? They managed to reduce the ratio bias by a whopping 84%. That's powerful proof that if you just aim for the right target, you can build a much, much fairer system.
Well, the fallout was pretty swift. New York state regulators launched an investigation and sent a really strongly worded letter to Optum's parent company, calling the practice unacceptable and unlawful. This put the entire healthcare industry on notice. Algorithmic discrimination isn't just an ethical failing anymore, it can actually be a violation of the law.
So, what are the big takeaways from all this? First, your proxy is your policy. What you choose to measure is an ethical decision that shows what you truly value. Second, accuracy can be a really dangerous illusion if you're accurately hitting the wrong target. And finally, and maybe most importantly, you can't fix social problems with code alone. True fairness requires things like external audits, transparency, and confronting the real-world inequities that our data so often reflects. And this leaves us with a critical question for the age we live in now. Whether you're building an algorithm, buying one, or being judged by one, you have to ask, what is this system really measuring? And more importantly, whose reality is it completely ignoring? Because the cost of not asking that question, well, it's just far too high.